So thank you, Divya. As Dr. Lekha was mentioning, till now it was very easy to make presentation because that was just scientific medical talks. So this was a bit different and I did not know actually how to go about it. So I'll try to see so the topic was like a woman's path in via surgery. So when I looked at it, it has two aspects. One is being a woman and second is a surgical specialty. So when I thought like, is being a woman a barrier in surgical field? Yeah, maybe decades before. So because who you see here is my mentor at LVPI, especially in pediatric retinal surgery, Dr. Subhadra Jalali, and to my right is my HOD at Little Flower Hospital, Dr. Elizabeth Joseph. So when I spoke with Dr. Subhadra, ma'am used to say that when she initially wanted to join for fellowship, they were hesitant to take her because being a female, after some time she will become pregnant, she will have kids, then kids will fall sick, so she will have to take leave. So they felt that it will be very difficult for a female to pursue a surgical fellowship. So, but then she stood against all these odds and she proved herself that being a female is not a barrier. And to my right, so in that photo right, it is Dr. Elizabeth. So she did not have any problem in getting into Little Flower Hospital. But what she said was, initially when patients came, they used to have two consultants in a room, and one used to be a male doctor and second used to be her. So when patients come in the queue, they will have a tendency to jump to the queue where the male doctor was sitting. So they had a hesitation. The patients used to have a hesitation to consult a female doctor, especially if a surgeon. So these things were there earlier. But I think as of now, does this barrier exist now? It has really come down. So I don't think any institute now would not give you a fellowship or a surgical branch just because you're a female. And even our patients, we know, many of us, in fact, we know like in many of the fellowships now, 90% are females. So I think the male gender has come down in especially ophthalmology. So I don't think this barrier is there, not much. So I was looking at, is there is any literature to look to see like what is this problem with this female gender and surgical field and all. So I came across this one of the article where they looked at the residents or the surgical residents and whether what is that factor which determines that. So when they looked at these residents and took the feedback, it was seen that whenever they came across a female doctor as a role model in their training, then they would tend to make or choose a surgical career as their choice. So they did have some influence on the person, especially if the same gender. So now I should say that because many of us are like female ophthalmologists, so all the junior residents, even if you see in our hospital, it's only 2 of them are ophthalmology residents are male. The rest are all females. So I don't think that barrier also should come now. And this was again another study which looked at what is the factor which influenced the choice of surgery as a career by pre-registration interns. So there they saw that the factors were like, one was male gender. So if the candidate is a male, they tend to go for more of surgical field. And especially if the person is single and not married, then their tendency to go for a surgical field was higher. And again, if they had a role model in their life, like their parents or their teacher or someone who had influenced as a surgeon, then the chance of them to go for a surgical field was very high. But many of them showed that the barrier being a woman was because especially when it's time to join for a fellowship, that is the time then they plan for a family, they get married. So the difficulty in balancing career with this domestic responsibilities is a main factor which many of them actually tend not to go for it. So in our education system or the training program, it should be in such a way that the system should accommodate or take care of this spirit. And not only the education system, but the family support. So this many a times women herself or themselves think that every responsibility of the kid and the entire family is on our shoulders. And as a disclaimer, I should say that I may not be a right person to say this because I belong to the category of single. And overwhelming lack of female role models in the surgical field is another thing. And second, another factor which mainly comes is it's more stressful. Rather than dealing with a medical, when you deal with a surgical, you have to plan. Then you are worried about if anything goes wrong with the patient. So you have to be like kind of stick with that patient, stuck to the patient. And the stress is little more than when you deal with a medical scenario. So these things are few things which might be like little challenging for a woman, but I think I should say that it's all our mindset. So if you think that you can do it, and like Divya was mentioning, if our ambition is like to become a surgeon, then none of these should matter. So why I became a surgeon? So I never felt when this topic was given to me, it never occurred to my mind that I cannot do something because I am a woman, except for maybe some physical task. But because I was brought up in such a way that I was never restricted that you should not do this because you are a girl. I was never brought up like that. I should thank my parents for that. So this is my father and mother. And it's then I realized that it's basically our mindset, how you are brought up. So if still anyone feels that being a woman is a barrier, it should start from us. In the sense, like when you bring up your children, they should not be brought up like you do this because you are a male or you are a boy, you do this because you are a girl. It should not be that way. You should give equal responsibility, and they should have a taste of both the household and the managerial task, so that they should know how to manage both the things. So when they become adult, they should know that it is not one person's responsibility, so that women get more freedom to do what they want. That is what I feel. I don't know what others take on this. So again, so this was another study which looked at the subspecialty training. So when I talk about VR, the studies have shown that VR is one of the most sought after specialty. And in that, again, when you looked at the ratio, it is mostly male. Maybe because what I feel is that why not many females come to VR surgery? First thing is that, as I mentioned, it is our exposure during our training period. So many of the institute actually, they don't have proper VR setup. They don't have proper VR surgeons to train them. And maybe that is the reason why, and till now, most of the surgeons in VR are like more males. Females are very less. So we don't get much an exposure to a female VR surgeon. That might be one cause. And then because you are not getting an exposure during your undergraduate or the postgraduate time, you feel that it's something which is very difficult to go through, learn, and all those things. It's because you are not experiencing it. So once you get a hang of it, I don't think that it is something which is like a very difficult thing to master. So why I chose VR surgery? See, basically Divya was also mentioning it's a passion. So I like these cataract and cornea. I felt that it's a little dry and it is colorless. Retina used to be very colorful. You see that red blood vessels, then that nice color disc, optic disc. So everything was very colorful. And then once you start doing little practice, you know that you can manage to do something little bit of cataract and everything after your post-graduation. But if you have to touch retina and treat, you need to have a special training. So I felt it was a little challenging. So whenever there is a challenge, then you feel like, okay, I should master it. And why someone would choose a specialty, there are some factors like individual and some external factors. Individual is like, once you feel that, okay, this is my passion, then you should look for things like, okay, how can I get it? So as she was mentioning, you should try to get the fellowship done in one of the best places. If that is not possible, try to get maximum utilization of where you are. So I was like very keen that I should get into LV Prasad. I don't know, for some reason when I spoke with people. So even though I got earlier in some other places, I did not join and I waited till I got in there. And so how you develop this interest, as I mentioned, it is either passion or some people might join because of your need. Need in the sense like, okay, you feel that, okay, if I join this, I might get better job placement, or in my area, this specialty is not there, or you might be already having a family practice wherein like I have to take over that. So this depends upon your personal choice and what gives you happiness and what is your interest, because that decides how you move along within your path. And one thing you have to remember, all our dreams can come true if you have the courage to pursue them. And fellowship, as everybody mentioned, it's not an easy thing, especially when you go to the premier institute. It's a very tough task. So you have to be mentally prepared to go through this. But I can tell you, like, it's worth it. But you have to be very patient. You wait, and then it will be fruitful. Another factor is mentorship. You should have good mentors. So this Dr. Annie Mathai, she is no more. So she actually taught me via surgery in the beginning by hand holding. And in many places, even in your workplace, your training period, you will have to face so many adversities. But as she was also mentioning, try to make use of the adversities, try to make best use of it. So after I completed my fellowship, I joined the hospital. For 6 months I could not get an OT space because it was jam packed, and I was asked to do emergency surgeries after everybody's list. So everybody used to call me like a scavenger. But you know what, I learned maximum to how to manage all the emergencies. I used to operate maximum of 2-3 foreign bodies in a day. So I became an expert in that. And after that, I got an OT half shared with Dr. Ajit Babu. He used to be one of the finest surgeons. So I used to ask his fellow, whenever I see a complicated case, if I can scrub with him. So then I got a chance to learn the best from him. So any adversities, you try to see how you can learn from it. So that is how you improve yourself. And pediatric surgery, again, after I did my VR fellowship, I realized that if you have to manage a pediatric, you need a special training. Even after you complete a VR fellowship, it is not easy to do pediatric. So that I felt it is a challenging thing. So I learned that, I decided I should master that too. So that is how I landed up with it. So it is like, it's your desire, your passion. And see, when come to training, don't think that all people are like born surgeons. They are not. So there are two aspects to it when you go for a training. One is you master the non-technical skills. That is how you see a patient, how you decide the patient needs a surgery, what will be the outcome, how you communicate with the patient. All these things come in under one category. Next is acquiring the technical skill. That is your surgical skills. So that you learn from your teacher, you learn from your seniors. So there is an initial phase where you first understand the procedure, then you try learning it, doing it, but you are likely to make mistakes. One more important thing is that whenever you are in your training phase, never be overconfident. Suppose your senior entrusts you with something, and if you realize that maybe I might go wrong, don't experiment. Get help. So that is the best way. That helps in two ways. One is you will not lose your confidence. Second thing, your trainer will have more confidence on you, and they will entrust more difficult cases with you because he or she knows that they will not do anything wrong. In case if they feel that they cannot do it, they will ask for your help. So this has two advantages. Next is the integrative phase. When the performance become more fluent, means like you are less likely to make mistake. Then many times many of the cataract surgeons, they don't even think beyond some level. It is at the spinal level. But when you become an expert, if anything goes wrong, it's your presence of mind and the ability to think and decide at that point what should be done. When you have that mind to decide on when you have to tackle the complications or an unexpected event, then you become an expert. So that is how you transform your training to become an expert. And as I mentioned that, so the initial phase will be like you become a competent, and then one thing is that many times in the training or in the fellowship, you feel that everybody compares with others. See, he is learning fast, he is getting more, I am not getting cases. It's not like that. See, some has an innate talent to acquire and grasp things faster. It doesn't mean that other surgeons are bad. And I have seen during my when I was a consultant there, trainees who had come with they did not know even how to put an incision. But it's their dedication, their willingness to learn which change things. See, if one can pick up a skill in 1 hour, someone might require a month. But if they are dedicated to do it, in the end, everybody will be the same. So now you understand, it's not like that you are a born surgeon, but you can make. But it's your dedication and will to do that. So advice to aspiring VR surgeon, think why you need it, whether it is your passion or your need, and choose the right place and try to make best use of opportunities, even in your adverse situations. And as you master these skills, the best way to learn and consolidate what you have learned is teach others. So when your juniors come to you, teach others. Because see, in your fellowship or in your training period, it's not possible to make all the mistakes that is possible. But when you assist others, they will make mistakes. Then you know that, okay, this is what I should not do. So many of them think that it is a waste of time training others. It's not like that. You learn the most when you do that. And one more thing you have to think that, so many of them will come and say, one consultant is doing like this, why you are doing like this? It's not like that. In medicine, it is not just only one way of doing things. There are different ways to do it. And different surgeons do it in different way. So if you're in a fellowship, you have the chance to see all these different ways, and you finally decide which way suits you better. So you adopt a way. That is advantage. Another thing, many of the fellows and trainees, I see that they'll come and sit in the surgeon's chair only when their case is being called. And rest of the time, they'll be roaming around. Never do that. Observe, observe, observe. Whether it is a co-fellow, consultant, anyone else. Because as I mentioned, you cannot make all the mistakes. Others will do. So learn from them. And observing is the best way to learn. Don't think that it is only when you do. And always be true to yourself. And always remember that patient safety is your priority. And every patient you operate or see, think that he is your relative. That is one way to do the justice. Via surgery, especially diabetic vitrectomy and all, it is a very humbling surgery. So don't think that if one of your cases became very excellent outcome, never become overjoyed. It will, after few cases, you will see that you will have to be always remain grounded. So thank you. So what I would like to say is that being women is our mindset, and become a surgeon is your passion, or it's your, what I should say, your willingness or your wanting. So there is nothing to hinder if you really want to. Thank you.
Thank you, Divya ma'am. That was an amazing talk. I always considered you as an angel sent to me, because when she left from LVP and she joined Giridhar, exactly like she said, she had held my hands through every complexities. So I really thank you for doing all that and making me here. Thank you, ma'am.